Hi everyone, it's me again. I'm Lena and I'm from the Healthcare Landscape Group. In this video, I'll be talking about my main video, which is EMS. Well, in this video, I'm going to talk about four main parts. The first part is what is EMS, the second part is the components, the third part is the process of EMS, how the steps that are taken in order to get the patient to safety, and also lastly, I'm going to talk about example of EMS in England. So let's get started with our first part. Now, what is EMS? EMS is Emergency Medical Services, and it is a system that responds to emergencies, specifically medical emergencies, and provides medical treatments and transport for that patient. So that's basically what EMS is. And think of an ambulance. That's like what I think of the thing that pops up first when the word EMS comes to mind. So EMS is an abbreviation of Emergency Medical Services. Next, what are the components of EMS? Well, basically the people, the healthcare centers, and the transport. Well, specifically, we are talking about emergency dispatch, transportation, pre-hospital care, personnel, hospital care, and healthcare facilities. So let's break this down. Emergency dispatch. You might have heard about dispatchers, police dispatchers, where they call 911, and the dispatchers pick up the emergency calls. Well, this is the same for EMS. Emergency dispatch is basically there is a dispatch call center where the dispatchers will receive the emergency calls and then dispatch and then connect with that service, like the hospital, and then send the ambulance or the personnel to the site of the emergency. Speaking of which, there's transportation. Well, there are all kinds of transportation for EMS. For example, there's the ambulance, there's helicopter, otherwise known as air ambulance, and other ways, any way possible to transport the patient to the hospital or healthcare facility. Pre-hospital care, well, that's exactly what it sounds like. Pre-hospital care. It's the care before you get to the hospital. So there's on-site care, there will be personnel that will do, professionals that will do life-saving procedures, and before they reach the hospital. Next, there will be personnel, which of course will be dispatchers, paramedics, physicians, nurses, and there's even the driver of the ambulance is called a personnel for the EMS because they are involved in the process of saving that patient. So that is another important component of EMS. Next is hospital care, which when you get to the hospital, when I'm sick, I'm in an emergency, when I get to the hospital, I will receive care, and that is care upon reaching the hospital, so that is hospital care. And lastly, there will be healthcare facilities. So of course, there will be a location, a place where I will be treated and where they will receive the patients. So for example, there will be clinics, hospitals, trauma centers, or medical centers as well. So they treat and receive patients. That's where the ambulance will be headed towards. That is the 6 main components of EMS. Next, the process of EMS. How do they get from that dispatcher to the hospital? Well, firstly, there will be the call for help, the emergency call. Well, if someone had a stroke, maybe their family member or people around or individuals around them will call 999 or 911 or any emergency number in their country. That is the call for help. Then there's the triage, where they will inspect and they will give immediate care. That is the third step, which is immediate care. Well, for that immediate care, they will need to do life-saving procedures, like maybe CPR if that is a heart arrest, cardiac arrest, or heart failure. And the stroke, we need to get them onto the actual ambulance and give them some medicine or give them shots or anything that will help with that stroke. And there will be transport. So during that process of giving the patient treatment or pre-hospital care, the ambulance will get going. They will need to arrive at the hospital as soon as possible. So that is the transport. Upon arriving at the hospital, the physicians at the hospital will reassess and diagnose what the patient is allegedly has. So they will reassess to see what is going on with the patient and then diagnose them and then give them treatment, and then after that treatment will stabilize their condition, stay in the hospital, let them stay in the hospital until their day of discharge, until their condition has stabilized, they have gone back to normal. Then after all that, we will get to the documentation, which is the boring stuff actually. We need to go over the cost, like the papers, the cost, things like that. So that is the documentation. Basically, that's the process. Two main criteria, which is the pre-hospital and the hospital. Lastly, I'm going to talk about the example of EMS in England. Now, there are two main parts. There is the NHS and the other parts. So for the NHS, for the NHS ambulance service, it will sometimes be a 2-person crew. Most of the time will be a 2-person crew or more. And the 999, the phone number is 999. That is the life-threatening, like emergency cases where you need immediate care. But for non-life-threatening cases, then we can call 111 for the NHS. That is one example of EMS in England. Some other examples of EMS is voluntary organizations like the St. John Ambulance provide medical cover at public events, and they also support the NHS. There's private ambulance companies like EMS Ambulance. They provide all sorts of things from transport to medicine, things like that. So there are private ambulance companies, and there's also community first responders, who are unpaid volunteers that have training with first aid or paramedic training. So that is the other types of EMS in England. But voluntary, private, or public, they all connect and are regulated with the Care Quality Commission. So that the Care Quality Commission will regulate all of the activities of the NHS and the voluntary organizations, private ambulance companies, community first responders, etc. So yeah, that is the forming parts that I have for my video today. I hope that you learned something new from this video or just review some of the things that you have learned. Thank you for listening to my video, and I hope to see you soon. Goodbye!